I first learned about the use of 2-day megadosing of vitamin A from a holistic pediatrician in Miami 25 years ago, where he taught me that it was the only known treatment for measles. He told me that he uses it for all types of viruses, and this has been a mainstay of my immune protocol ever since. Now there's compelling evidence that this could be helpful specifically for COVID. So let's talk about it. Hey everybody, it's Dr. David. So, being a pediatrician here in Tampa, Florida, I did my pediatric residency back in the mid 90s at Tampa General Hospital, where I learned pretty soon after doing my education there that I wanted to be involved in natural medicine, looking for root causes of things, but how can we treat things without medicine when it's appropriate? And so I finished my residency. It would have been in 97. And I moved to South Florida, of which I then quickly learned about a Dr. Eric Ridland. Hi, Eric, if you're watching, who was the first holistic pediatrician in the state. He was very generous, invited me down to his practice where he taught me about his use of an herbal line that he had developed specifically for kids, alcohol free. He taught me about how we use high dose vitamin A for measles, that it was approved for measles in the World Health Organization and the CDC guidance, but he was using it for all types of viruses and seeing tremendous quick improvements in people who had infectious diseases. He also taught me about how he would use short courses of higher doses of echinacea, of vitamin C, and for zinc at the same time. And that all together, of which I've done tinkering over time, but that really became the basis of my immune support protocol that I've talked openly about many times before and have had lots of success with. Often people tell me by the next day they're feeling better. Many people with COVID have told me they've really kicked it around quickly. So I figured, well, this is a good time to start looking at it. Now, of course, very important. High dose vitamin A, megadosing, can be damaging if done long term. Please be clear, we're talking about only 2 days worth. Okay. And there are also some contraindications, certain medical conditions that high dose vitamin A may not be so good for. So this is not serving as medical advice. I'm educating you, but of course, you should please check with a knowledgeable medical provider before doing this, especially if there are any underlying medical conditions. Okay. Now, this kind of came up for me this weekend when a couple of my family members tested positive for COVID. And I know if you're exposed and you start it, that may be even the best time to start vitamin A. So I went and got my vitamin A bottle. And then I'm like, it's been a little while since I've looked up to see if there's anything specific for COVID using vitamin A. And because I had last looked, it probably was like early 2021. Probably should have looked even sooner. But I then went and found that there was this actually really nice review article from 2021 that I'm going to describe in a little bit more. And so what they basically did after I took my vitamin A and I started reading about this is I found an article, as I said, it was from 2021 in a journal called Reviews in Medical Virology. So these are review cases. They're not independent research that they're doing, but they're doing a conglomerate, like looking at a meta-analyses and other things, basically putting all information together for a particular topic, a particular treatment, etc., kind of as a review article. Not kind of, I guess it is a review article. Okay, and this particular article was called, let me get it right, Mega Doses of Retinol. Retinol is vitamin A possible immunomodulation in COVID-19 illnesses, especially in resource-limited settings. And the reason why they were doing that is, of course, first of all, vitamin A is very cheap, certainly cheaper than any medication that's ever been used for COVID or for other things as well, for other infections, cheaper than antibiotics for that matter. And so we wanted to kind of see what they did. And again, so the research that they provided. Now, one of the things that they first started talking about was with the thing that I had learned about, okay, which was in 1993, there was a research study that was done looking at high dose vitamin A for measles. Okay. And they found that it was directly related to the blood levels in terms of the benefit of the individuals. They found that vitamin A were in those who had very serious measles disease were more likely to be low. But they also documented and found information that when you get measles, it may actually even though it may it may overall not lower the overall body vitamin A level, but the release of the vitamin A in order to do its job. Okay, they actually show that this was even more helpful, more protective for children under the age of 2, which are the ones that are most likely to have the more severe diseases when it comes to measles. But then there was another article in 2021 that showed that the same type of dosing, which I'll get into in a minute, showed a lowering of Ebola death by 17%. Okay, that's not 100%, of course, but we all also knew that the chances of survival with Ebola, which was discovered in the last decade, was rather severe. The likelihood of dying from it, a very, very, very bad disease. Okay, so now what is it about vitamin A that we think is helping? Okay, first of all, one of the things that it was shown to do is it promotes immune system homeostasis. We've discussed the word homeostasis lots of times before, and this is where we need to make sure that we have an immune system, the increasing of inflammation, enough to fight off the infection and push it back, while at the same time not overdoing the inflammation. When we learned about cytokine storms during COVID, that was a prolonged and elongated inflammatory response that led to all the problems. So it wasn't the virus per se as much as it was the immune response to it, whether it was how it was overreacting in the first place. Of course, now being that 96% or more of people have antibodies against COVID, of course, that's a very much big part of the immune system and the initial attack against it. Because when SARS-CoV-2 was a novel virus that nobody had seen, while we did have some inborn, what we call innate immunity, that would build up that can fight off any respiratory infection, especially because of how the lining is of the nasal passages, lungs, etc. But we obviously didn't have what we call, the specific cellular immunity of the T cells and the B cells or the antibodies. Now we do. Okay. But what it also showed was, that it actually, vitamin A can augment the immune responses to RNA viruses. And of course, as we remember, that this is an RNA virus, not a DNA virus. And by the augmentation of these cytokines by the vitamin A, it would actually slow the reproduction of viruses, slowing the growth of viruses, giving our immune system more time to come in and to knock it out before it overwhelms the system. Okay. But also, vitamin A has a direct impact on the ACE receptors, and especially in the respiratory tract. And as we kind of had talked from a very early finding in COVID, that it was attacking ACE receptors. And that's why a lot of people who had cardiac and blood pressure problems were particularly susceptible to hospitalization and death from COVID because of this entry through the ACE receptor. Okay. But vitamin A actually impacts it. It modulates that ACE expression and can make it less so. And that's why I think it works with flu and all the other things that I've done it with, because it's keeping the ACE receptors, especially for COVID, why I think it works for that, I should say, is because it's keeping those moderated. Okay. In addition, vitamin A does increase the production of secretory IgA. Secretory IgA is the antibody that our body puts onto our nasal passages, as well as our respiratory tract, as well as our GI tract. This is the first line of defense. Okay. And of course, we don't necessarily have specific secretory IgA if we've never been exposed, but it does get made early in the disease. But also, once we've seen the disease, our body is putting IgA antibodies onto our lining so that we can again have that first line of protection. Okay. Now, in terms of there is now a current study going on for vitamin A specific to COVID. Okay. And it's using, they're trying both oral forms, but even nebulized, like in aerosolized forms of it to get straight to the nasal cavities and down into the lungs. So, it's going to be a while before this is out. I'm thrilled to death to know that there are researchers that are looking at something that some of us have known for better part of a century, but they're actually looking at, and they're looking at specifically going to be looking at and how it impacts sick adults. Okay, so yeah, I'm sure they'll do it for kids maybe at some point, but as we've known all along, that COVID has not been the serious disease for the overwhelming majority of children like it has been for adults, especially those at high risk. Okay, now let's talk about the vitamin A dosing. And again, to reiterate, this is education. This is not a one-on-one medical advice to you. However, The information, especially regarding measles, is straight out of the World Health Organization and CDC manuals now. So this information that I'm giving you here is from them in terms of the dosing, okay? Now, I do also, before I get into that, want to point out some of the long-term concerns of high-dose vitamin A, okay? It can damage the liver. It can increase the pressure inside the brain. It can elevate blood calcium levels to a dangerous. You don't want to have calcification or too much calcium in your blood. It can also weaken bones, etc. So can be really dangerous. But again, that's for long-term use. Okay. Now, in terms of the actual dosing, this is what the World Health Organization says. Okay. If there's even been an exposure, and they're even talking about in communities where there is and I'm talking with measles in particular, where they're even suggesting a few times a year prophylactically in those, especially more underdeveloped countries, of giving these high doses of vitamin A for the short period of time, just to prevent, if they were to catch measles, that they would have a better chance of fighting it off. Okay. And what they said was for children under a year of age, 100,000 international units of vitamin A for 2 days. And after one, and they said up to age 5, 200,000 units per day of for only 2 days. Now, it is important to recognize we are not talking about beta carotene. That is available as a supplement. It is a pre-vitamin A. But your body will only naturally convert enough beta carotene to vitamin A for what it thinks it needs. So otherwise it won't make the conversion. So you have to take it as either the cod liver oil form, which is retinol, or vitamin A palmitate, which is a synthetic form, but they both create retinol and retinoic acid, which is the active ingredient. So it can be done either way. I typically take myself cod liver oil capsules of it, but I would have no problem if a person did it as the vitamin A palmitate form instead. Okay, now, because of the fact that it is approved for up to 200,000 as the stated dose for young children, I, in my own practice, and again, this is not medical advice, this is sharing my education, will typically give up to 400,000 per day. Typically, I divide it into 2 doses, but again, only for 2 days. Okay, and I've seen no problems with this, but again, no one should be taking it long term. Okay, now, I know a lot of people will hear these types of doses, and and especially other doctors who just don't understand. There's a recommended daily allowance. This is how much a person should take regularly. Young children, 1,250. Again, I mentioned 100,000 for the 2 days, and up through after age 5 and into adulthood, 3,500 to 5,000. Okay. Now, I had a situation. This is about 15, 17 years ago, where they were doing it as drops, and for this young 18-month-old, they were supposed to only give 3 drops of this vitamin A. And after the 4th dose, the mom reread my note, and she misunderstood and thought it was supposed to be 3 dropperfuls. So this child had 30 times the dose that I had recommended. And she called me up, I remember, on a Saturday afternoon out of my patio, and I kindly had to say, let me call poison control. I was kind of internally freaking out, but I didn't want her to know that. And I called poison control. They took the weight, the age, the information, and the lady says, I'm like, what? She says, well, according to our algorithm, it says, tell them don't do that again. And like, no liver testing, no stomach pumping, no hospitalization. And she says, no, our algorithm actually says if the kid would have taken double that amount, it still would have been okay if just for 2 days. Okay. So I didn't want to have poison control to be the reinforcer that I did, but that obviously made me realize that just for the 2 days, that this is an okay thing to do. Okay. Now, as I said, I would automatically start it on the first sign of any illness, but again, for me, I'll start taking it if I'm exposed, which is what I just recently did. Okay. So in terms of this now, in our practice, and I know I've also talked about for our Patreon subscribers, so if anybody's not, you want to get information to this protocols, as well as my entire immune support protocol in our patients. It is in our patient portal. It's shared as our documents on our Patreon account. I have shared it in the past if you want to go looking back to some of my original COVID articles. So there you have information about a very powerful, very accessible, very inexpensive treatment that could make a difference, not just for COVID, but really all the respiratory viruses, especially if they are RNA viruses. So there you go. Have a good day.